Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health here, helping employers, payers, and healthcare systems with their population health improvement programs. So, Nick, we've been riffing on this issue. It's now number 99, episode 99. We're approaching the triple digits mark. And we're sort of in an unusual place right now. Not a lot of interesting news coming out. So, what do we think's going on, and where do we think it's going to go from here?
Well, I'm just going to say 99 red balloons floating on the... And the whole story behind that and how that, I think, set off a war. And it was originally in German, if I recall, but Eurovision Song Contest, for those of you that don't know. But yeah, you're right. There's not a lot. I mean, I'm seeing a fair amount of traffic content that's saying withdrawing, reducing. Essentially, if I go 2 miles one way where I live, all the restrictions are off, mask requirements are gone. They're still in place, but not for much longer in my particular county. There's, wide variations. CDC is talking about changing the requirements. At this point, it's business as usual, with the inverted commas, I think. Whatever usual is in your particular instance. And that probably varies by country as well.
Absolutely. And I think I saw an article in which the Moderna CEO said it looks like we may be approaching the end of the pandemic with corona, possibly, maybe, whatnot. And it is
That's
interesting.
purely a classification, right? I mean, pandemic is a status, and it lends specific oversight regulations and, importantly, reporting regulations for health authorities, both domestically and internationally, to say if you identify that disease, then you must report it. So that comes with a bunch of requirements. But, beyond that, we move to endemicity. I'm not sure how to say that, but...
Yeah. Yeah, and the other thing that was interesting is at the same time, I think it was Dr. Topol or somebody put up there on Twitter, we're still seeing 3,000 deaths a day from COVID, which is not an insignificant number. But as a community, as people, we've sort of reached that point, I guess, of that limit where we're going to try to move on a bit, which maybe as the numbers keep dropping will be appropriate and we can get back to some level and then see how this thing rises or doesn't in the future.
Yeah, and I think the metrics that people are following or will be focusing on, even the CDC has shifted. And certainly in one of the interviews that I did earlier on in the pandemic, is moving away from reporting the number of tests to the number of hospital cases and the number of severe and consequential hospitalized based impact of the disease. Then becomes the monitor point for saying problem or not a problem versus we've identified it. I think at this point we're seeing it much more frequently, but not necessarily with clinical symptoms.
And that brings up a really interesting point that's raised its head over the last couple of weeks, which is admitted from COVID or admitted with COVID. And I look at that as a former hospital administrator and having looked at coding and all this stuff and the population health programs and say, yes, there are differences, but sometimes the with COVID, the diabetes flared up or the heart condition flared up because of the underlying COVID infection. So that should have been the cause of admission, correct?
Yeah, I think it's very hard to tease that out and say, oh, well, you came in for diabetes, but you happen to have COVID. And depending on which side of the fence, and I don't want to call it a fence because I don't see it as a conflict of, opinions. I think we have differing opinions, and it depends. I remember learning when I did statistics, there are lies, damn lies, and then there's statistics. You can make the statistics sort of show whatever you want them to show, and that's also subject to the source data and how you interpret it, and that's part of what you're referring to. And you're entirely right. Sometimes somebody may come in for another condition, but it was contributory because they had COVID that it worsened. And then the question is, what do you code for? And that's one of the challenges with coding. You assign a code. We're not codes. We're complex human beings that come with many different contributory factors. And, that's going to make life much harder moving forward from an assessment standpoint. And, it'll be lots of opportunity for arguments about, I imagine.
Yeah. And it's certainly, as we look at the situation now, the infection rates are coming down, which means as you just walk around, there's less risk associated with potentially bumping into somebody who's infected. So that makes everything a little bit easier and does allow, obviously, to begin to open up and do other things. I think we still need to look at some of the lessons learned or things like air handling systems, where we've locked buildings down tight, and you've talked about that before, and things like that. And as we go forward, I know I'll change some of my behaviors going forward. And we'll see where masks, I think, are appropriate or not. But certainly things around indoor ventilation stuff have raised their level in my mind, and things I'll probably follow through with going forward.
Yeah, and gosh, I remember the time when buildings became hermetically sealed, and you walked in, you got as you opened a door into an office, and you go, whoa, and you couldn't open any of the windows. I think hopefully we've learned a little bit from that. I think the one area that remains challenging because it's potentially even worse than the United States is all of the international aspects and travel, because prior to that there were some limitations. So I certainly existed in a world that had yellow fever vaccine. I had the yellow fever vaccine multiple times as a child because of where we lived. It was a requirement. Question is now, are you going to need it? And it is a smorgasbord of regulations. So good luck trying to work out. I think you still need a test to get back into the US at this point. That may disappear.
Right. It'll be interesting to watch how each of these countries handles it. And then where we go in the future with new other pandemics that will come at some point. We'll have different things come out, and how we choose to handle those, and the methods we use, and some of the things hopefully we've learned from this one, both from our successes and our mistakes that we made.
And from our 99 episodes.
Absolutely.
Right, Fred?
99.
Hopefully we've contributed to the growing knowledge of all of this.
So at the next one for 100, we'll have to see. Maybe there's something unique we have to do. Are there any of those helmets left you used to wear with the aluminum foil on your head?
If I hadn't moved house, I'd be able to find it. Actually, I might try and find it, especially or make a new one.
That sounds great. Well, once again, another fantastic week, Nick. Congrats on achieving 99 red balloons. And this is Fred Goldstein with Accountable Health. If you'd like more information, please reach out to accountablehealthllc.com.
And this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.